Hi everyone, and welcome to TS Fibro, or welcome back to TS Fibro. For all of my subs, thank you so much. And if you haven't subbed yet, please hit that subscribe button and hit that notification bell so you'll get notified of my videos when they come out. And if you like my video, hit that thumbs up for me. Today's video is on sensitivity to pain. It's another one of those fibromyalgia symptoms that just doesn't make sense. Pain, sometimes severe pain from a simple touch. The closest thing that it compares to is like having a sunburn all the time. A lot of people don't understand this symptom, including those who have it, because while it's a common symptom in fibromyalgia, it's rare in the general population. This kind of pain is called tactile allodynia. Here's what that means in non-medical terms. Tactile means touch. Allodynia means that your body perceives something as pain when it's actually harmless. Pain is supposed to come from damage, but no damage is present or being inflicted. So tactile allodynia is what makes your clothes hurt when they touch your skin, what makes a sheet feel like sandpaper, and what turns a light touch into searing pain. Tactile allodynia can range from mild to severe. It can be all over the body or only in certain areas. It can be constant, or it may come and go with symptom flares. Sometimes allodynia may be set off by something such as scratching or itching or stepping on something sharp. Common complaints from people with this tactile allodynia include burning and or squeezing, tight pains from waistbands, even if they're not tight, bra straps, socks, and other clothing that constricts or puts pressure on the skin. And every woman in here knows that if you have fibromyalgia and this tactile allodynia, which comes with the fibromyalgia, you're taking your bra off as soon as you hit the house. Pain from tags in shirts or stitching that's against the skin. All over pain from fabrics that aren't extremely soft, even fabrics that other people find soft, such as silk or satin. The good news is that there are ways to find relief from clothing-related pain and get more comfort in bed. I have a really soft blanket. It's just one of those throw blankets, and my skin has been acting up the last few days, so I don't get under the sheets. I get under that throw blanket because it's really soft, and that was all I could handle, could stand on my legs. So that's what I do. This form of pain comes from a malfunction of specialized nerves called nociceptors. The job of nociceptors is to sense information about things in your environment, such as temperature and things that may cause you harm at skin level. You know how sometimes your hand will flinch away from a hot burner before you even realize that you're about to burn yourself? That's due to the unique action of nociceptors, which actually work on their own without having to send signals to the brain and get a response back. In fibromyalgia, for some reason, nociceptors start perceiving that all kinds of sensations are painful. Researchers believe it's part of the central sensitization that's associated with fibromyalgia, chronic fatigue syndrome, and a handful of other conditions. Top treatments. Any treatments that lessen your fibromyalgia symptoms may help alleviate allodynia. If this is a major symptom for you, you may want to consider a treatment that's known to work well against this type of pain, like antidepressants, seizure drugs, and topical lidocaine. Some people also get relief from topical pain creams, including, any Tiger Balm, Aspercreme, Biofreeze. It can take a lot of experimentation to find what works best for you. As you might suspect, massage may be tricky for someone with allodynia, as can other treatments that involve someone touching you. You may also want to experiment with lifestyle habit changes that may help you lessen or avoid triggers. Other forms of fibromyalgia, allodynia also comes with two other forms. Mechanical allodynia that involves movement across the skin, such as from clothing or even air. Thermal allodynia, this involves temperature, which can be heat, cold, or both. Fibromyalgia involves other pain types as well, including hyperalgesia, which is a pain amplification by the brain and nerves, and paresthesia, which is abnormal nerve sensations such as burning, tingling, itching. People report other types of pain as well, but not all of them are medically classified, let alone understood. Hyperalgesia is an increased pain response that's common in fibromyalgia and chronic fatigue syndrome. In fibromyalgia, it's such a significant feature that it essentially defines the condition. Put simply, when you have hyperalgesia, your body makes sensations more painful than they should be. This is often referred to as turning up the volume on pain. It is a real physiological phenomenon and not due to mental illness such as hypochondria, nor is it the result of a person making a big deal out of nothing, which we've all heard before. High-tech brain scans demonstrate this over-response to pain, with the pain centers of the brain lighting up far more for people with illnesses featuring hyperalgesia, boy, some of these words are hard to pronounce, than in those without. That shows a difference in physiological, not psychological, experience of pain. For example, if the average person would rate a particular sensation at a 5 on the pain scale, someone with hyperalgesia may rate it at a 7 or 8. The increase in pain due to hyperalgesia can be confined to certain areas of the body, or it can be widespread. An odd feature of hyperalgesia is that it doesn't directly cause pain, it simply intensifies it. A person must have pain from another source before hyperalgesia can have any effect. The increased pain due to this symptom is sometimes what makes a difference between a person being functional and being debilitated by their illness. While it seems to be contradictory, opioids, pain relievers such as Vicodin, hydrocodone, Oxycontin, oxycodone, can sometimes, with long-term use, lead to hyperalgesia. This is called opioid-induced hyperalgesia. In these cases, the medications people rely on to feel better are actually making them feel worse. The solution is to stop taking these types of medication. Do not stop taking any medication until you talk to your doctor and see, because a lot of these medications, especially opioids, don't just stop them all at one time, because that'll cause more harm than good. Hyperalgesia and central sensitivity syndromes. Hyperalgesia is a common underlying feature of a category of illnesses called central sensitivity syndromes, which include fibromyalgia and chronic fatigue syndrome, irritable bowel syndrome, restless leg syndrome, and several other conditions. It's also associated with some inflammatory conditions and damage to certain types of nerves. Additionally, hyperalgesia can be a response to immune system cells called pro-inflammatory cytokines, which your body releases in response to infection. Pro-inflammatory cytokines are theorized to be present in some cases of chronic fatigue syndrome. It is not yet known whether that's because of an ongoing infection or due to a chronically activated immune system. Many of the treatments for fibromyalgia or chronic fatigue syndrome are aimed, at least in part, at reducing hyperalgesia. This includes antidepressant medications, anti-seizure medications. This pain type is different from allodynia, which is also typical of fibromyalgia symptoms and present in some cases of chronic fatigue syndrome. Allodynia is a pain response to something that's not normally painful, such as a light touch. Allodynia is also referred to as skin pain, as it commonly manifests as extreme sensitivity to pressure or movement against the skin. Paresthesia may cause various symptoms in your arms or legs. These may include numbness and tingling, pins and needles, itching, difficulty contracting your muscles and using the affected arm or leg, a feeling of cold, burning feelings, feeling like your leg or arm has fallen asleep. Symptoms are typically felt in one arm or leg, but both arms and legs may be affected depending on the cause of your abnormal sensations felt from paresthesia. Rest assured, most cases of pins and needles on your foot falling asleep are simply caused by assuming an unnatural position and are quickly resolved by moving around a bit. Most cases of paresthesia can be prevented by sitting with proper posture while watching TV or reading. Other causes can include compression of a spinal nerve from a herniated disc, compression of a nerve due to assuming poor posture and positions, tension and traction or pulling on a nerve, altered nerve functions due to illness or disease like diabetes, central nervous system conditions such as a stroke or multiple sclerosis. If you constantly feel symptoms of paresthesia, you should seek medical attention from your doctor. In general, if your numbness and tingling symptoms come on while you are sitting in an awkward position, then they should go away within a few minutes of moving around. After a half hour or so, you should be back to your normal self. Usually when I get them, it doesn't take that long. If your foot or arm remains tingling or difficult to move after an hour, it may be time to check with your doctor. If the cause of your paresthesia is due to an acute central nervous system condition like a stroke, then time is of the essence. Getting the right diagnosis and medical care immediately is necessary. Always check with your doctor if you're having unusual symptoms. If you have paresthesia, then that comes on gradually, and if you have a medical condition like diabetes, you may not be too concerned with your pins and needles or numbness worsens. It may just be due to high blood sugar, but a worsening case of paresthesia should still be monitored by your doctor. Peripheral neuropathy caused by diabetes usually starts with a feeling of paresthesia in your foot or feet, and it needs to be managed appropriately by your doctor. Okay, everyone. Anytime you get an unusual symptom that you haven't had before that's been diagnosed as part of your fibromyalgia, please go to the doctor. And if you feel uneasy or worried, go to your doctor. Don't sit there and worry yourself and it be part of fibromyalgia, and it's not going to be something that's going to kill you, even though fibromyalgia sometimes feels like that it is. And you don't know how you can hurt that bad and be in that bad a condition and not be dying, but you are. But please, everybody go to your doctor with any unusual symptoms or any symptoms you feel uneasy about, and make sure you consult your doctor. Okay, everyone, that's the video. I hope everyone enjoyed it. I hope everyone comes back. Hit that thumbs up for me, and I'll see you on the next video. I pray for a cure, and I pray you have a pain-free day. God bless everyone.